I'm Dr Ruth Sharrock, I'm one of the respiratory consultants at the QE in Gateshead, and we're really pleased to be supported by the Help Us to Help You campaign to encourage people to come forward with any symptoms that they're worried about as regards to their chest and their breathing. Very much if you've suffered with a cough that's gone on for more than 3 weeks, if you're coughing up any blood, if you've got any unexplained pain around the chest wall, if you're more breathless, tired or losing weight, and particularly in those people who've smoked or are a smoker, we'd really encourage you to go and see your GP and get checked out. Our services are up and running as normal despite the impact of COVID, and we can guide people through the process of coming up to hospital, having appointments, meeting the team, having investigations and tests and treatments, all running as normal. And so we'd really like to encourage more people to present with any symptoms that they're worried about and not to feel afraid about coming up to hospital, recognising it has been a worrying time and things are a little bit different. We're wearing masks and visors and pinnies to keep everybody safe. It's the same people behind the masks and we're here to look after you. Some people get referred up by their GPs because of symptoms that they're worried about, and some people have had a recent chest x-ray with a finding that we're not sure about and we need to arrange more tests. So we often either see them in clinic or over a phone call and arrange for them to go and have a CT scan. Some people are a bit nervous about having the scan, but we've got quite modern scanners here and they're in a big open room. You can see out the whole time while you're having the test, and there's very experienced staff in radiology to support people going in, talk you through what's involved, and the actual scan itself only takes about 5 minutes. There's lots of paperwork and procedure beforehand, but the scan itself is really very quick in and out, and we can often give you some information on the same day that you're having the test, so you leave knowing a lot more about what's going on and what the plan is and what the next steps are, which is a comfort to anybody. So a lot of people coming up to have tests and further investigations, we find that there's a very benign or simple explanation for their symptoms, and we're hopefully able to quickly reassure them that nothing further is required. But for the smaller proportion where we find something more worrisome and more tests are needed, we've got a very small, very friendly team of consultants, specialist nurses, radiographers who help support you and guide you on that journey. We're contactable all the time, got an answer phone message and telephone numbers that you can ring anytime. You can bring family members to appointments with you, and we try and be very flexible in terms of when we see you and how we see you and how you can contact the service. So we try and go on the whole journey with you, and often it involves tests at different sites such as at Freeman, but we coordinate everything from here and help you navigate that path and get on with treatments. And the specialist nurses, if someone were to be diagnosed with a lung cancer and go on and have different treatments for that, the specialist nurses follow you through on the whole journey as well, so they're with you every step of the way, and even if care is being provided by different team members over at the Freeman, we're always here for you if ever you needed anything.